I'm Dr. Tammy Balatgek from the Center for TMJ and Sleep Disorders, and you're joining us today for our series called Your Mouth is the Door to Your Health. And I'm very happy to be with Gina this morning. She's going to tell us a little bit about her experience in our office. So welcome, Gina.
Thank you.
Before we get started, do you want to just share a little bit about how you heard about our office or how things got started for you?
Sure. So a neighbor had shared with me that her son was seeing Dr. Tammy, and she said how much she enjoyed the staff and your diagnosis of her son and helped her son. So I decided my children at that time had needed some dental work, so I brought both of my children into the Center for TMJ, and my son had an overbite, which was corrected, and my daughter's teeth were corrected as well. So that's how it started.
Great, thank you. And were you having some issues too that you wanted to explore, or?
Yeah, a little later on, I had noticed that going to my regular dentist, he had mentioned that I had wear on my teeth, and he had suggested that I wear an upper plate. So I started wearing an upper plate, and then I would go back and he would tell me that the plate needed to be replaced. And then I started noticing that I was actually getting cracks in my teeth, and I was told that I needed crowns. And as you well know, crowns can be very expensive. So just for 2 crowns, it was like $3,000. And at that point, I started getting a little concerned because I have more than 2 teeth in my mouth. So if this continued, I knew it would get rather expensive. So I just came in for an exam and obviously got an appliance and stopped breaking my teeth, didn't need any crowns, and a nice side effect was the fact that I'll never forget the first night that I wore my appliance. I felt cold air going down my throat, and it was just a really weird sensation. Weird, but in a very good way, and I started sleeping much better at night. So that was a nice side benefit that I really hadn't even anticipated.
Great. So if I can back up just a little bit, could you explain a little bit more about the plate that you're referring to? A lot of patients will come to us and they've been wearing a mouth guard made by their dentist, and it just goes on either the upper or the lower teeth, but it still allows for grinding and clenching to go on. So is that what you experienced?
It is, and the plate that I was wearing was just an upper piece, and it was only on perhaps maybe the first 4 teeth. And so it seemed when I was awake and I would try to bite down, it seemed like it was preventing my teeth from coming together, the upper and lower. However, obviously I was still grinding and breaking through.
So even with your mouth guard from your dentist, the upper plate were still able to grind your teeth and clench?
Yes.
And you mentioned that once you got the appliance from our office, which is a little different in that it's an upper and a lower piece that's joined together, you're able to breathe better at night. So one of the things that Gina experienced is that with that single plate, her jaw could still fall back and her tongue could get in her airway and create a stopped breathing situation. And so the difference with the new mouth guard is that she can breathe better and sleep more deeply. Is that what you feel you've experienced?
Absolutely, absolutely. There isn't one night that I go to bed without my appliance in.
Wonderful. That seems to be the theme.
Yeah, you fall in love with it. You just sleep so much better.
Great, great. And Gina, also you mentioned your children coming in to the office. So our office does provide orthodontics, and we approach our orthodontics from the same standpoint as treating jaw problems and sleep apnea, by helping the arches to expand and the airway to get larger. And so in your case, do you want to talk about your children's treatment and how they were able to avoid braces?
Sure. What I first noticed with my son is he had an overbite, and it's hereditary So I've noticed it in my brother, similar to my brother had gone to an orthodontist, I guess in his early teens, and they put braces on, and it never corrected his overbite. So I was concerned about my son, so I actually, before coming to you, I took him to a very well-known orthodontist in the area. And he was young at the time, and they said, well, bring him back when he's 14, and we'll put braces on him. And right away, light went off in my head, and I thought, this is the same thing they did with my brother, which is not going to correct the issue. So I brought him to you, and you obviously treated him. So his teeth are beautiful to this day, no overbite. So I'm so glad that we had done that.
And what did his treatment consist of?
It was a palate expander, so it actually expanded his upper palate, and so his teeth came in just beautifully. Never needed braces, and the lower piece actually just brought his jaw out, and it was just a very slow process. It wasn't painful in any way. It was a little cumbersome at first for him to get used to, but after that, you know, that time goes very quickly, and certainly it's worth it in the long run.
So we were able to work with your son's growth and expand the jaws and the airway. And when everything lined up properly, then there weren't any forces from the muscles to move the teeth or crowd them. And that's what allowed them to stay in alignment. So he'll be in good shape for long term.
Yeah, so thank you.
So, oh, you're welcome. And with your experience just talking to friends or other patients who've suffered with this, what are some of the other symptoms or things that you can bring up that people might be experiencing that would drive them to seek treatment?
Well, I talk to a lot of women, and I think at a certain age, a lot of women will typically say, I don't sleep well at night, and they think it's just because of their age. And I don't necessarily think that's the case. I think a lot of the problem is that they don't understand the whole concept of going to sleep and our tongues falling back in our airway that just disturbs our sleep cycle. And so even if people don't wake up and physically walk around, it's still disturbing sleep. And so I do hear of that a lot, and I often, I'm a big advocate, obviously, because I have seen the change. And so I do share with a lot of women that you know, they certainly should look elsewhere and not self-medicate and just think that they have to live through it.
Wonderful, thank you. Well, thank you, Gina, for joining us. And to sum it up what she just said about sleep as one of the issues, that's why our center is called Center for TMJ and Sleep Disorders, because we do help patients to achieve deeper levels of healing sleep and improve their overall wellness. So thank you for joining us today for Your Mouth is the Door to Your Health. I'm Dr. Tammy Balatgek, and I can be reached at 610-796-2835, or our website is tmjsleepcenter.com.